Psychotic disorders. Personal data. Name: Jorge Daniel Silva Garcia. Email: ares.daniel@mail.com. Facebook: Jorge Daniel. Twitter: @Donueto. Teacher: Moscoso Escobar John Fernando. Definition: are a group of serial illnesses that affect the mind. They make it hard for someone to think clearly, make good judgment, respond emotionally, communicate effectively, understand reality, and behave appropriately.
Visualize yourself out with friends. You're at your favorite restaurant waiting to be served. Suddenly, you notice people are watching you. You begin to hear people whisper your name. You know they're about to do something. Your friends don't notice that you're all about to be harmed. You mention what's happening to your friends, and they're confused. You have to make them understand quickly before something bad happens. If you've experienced something like this, it could be psychosis. Did you know that a little over 3% of all people will experience psychosis at some point in their lives? That's over 11 million people in the United States alone. In any given year, about...
Application in medicine. Schizophrenia is one type of psychotic disorder. People with bipolar disorder may also have psychotic symptoms. Other problems that can cause psychosis include alcohol and some drugs, brain tumors, brain infection, and stroke. The treatment depends on the cause of the psychosis.
Schizophrenia is probably one of the most ill-treated, stigmatized, and misunderstood psychological disorders that exist. Although schizophrenia is a widespread psychological syndrome, there are misconceptions where people would assume that schizophrenia is this one disease that causes all these extreme behaviors. Kind of. Actually, there are many different types of schizophrenia, all different in the behavioral symptoms and distinct characteristics. First, the most commonly occurring type of schizophrenia is paranoid schizophrenia. Patients of this subtype do not display major symptoms until...
Pro. The specific diagnosis can help people identify and empirically support treatments that have a good track record for symptoms reduction and decreased pain. Cons. Having mental problems or being known for psychotic problems can be stigmatized and confused with psychosis and violent behaviors.
Hi, I'm Jeannie C, and I'm here to tell you about the symptoms of schizophrenia and the criteria for diagnosis. There are 5 main symptom areas in schizophrenia that we look at. One is delusions, which are fixed false beliefs that are not shared by other people in the culture. And so those can include paranoid delusions, that other people are trying to harm you, or that there's a plot against you, or grandiose delusions, where you feel that you are more important than perhaps you are, that you have a mission to accomplish, or things like that.
Issue applied in Ecuador. About 1% of the world population suffer from psychotic disorder, which affect men and women equally. The symptoms of psychotic disorders can sometimes be so severe to the point that they significantly impair a person's ability to engage in normal functioning because it disturbs the ability to stay in touch with reality.
In the process from psychosis onset to recovery, 5 phases may be distinguished, namely early phase, being overwhelmed, the struggle, living with your experiences, and living past your experiences. 1. Early phase. Everyone can have mild psychotic experiences. Usually, these are brief and transitory, in which case there is no problem. Sometimes, however, mild psychotic experiences represent the early signs of a psychotic disorder. Therefore, if mild psychotic experiences become more severe, more persistent, or more frequent and start affecting your daily functioning, it would be wise to contact a mental health.
Conclusion. Psychosis is a neurological syndrome associated with abnormal functioning of the frontal and temporal lobes and the dopaminergic projections to these areas. People with psychosis may experience hallucinations, delusions, and disorganized thoughts and actions, and may have personality changes.
My name is Dr. Pam Mackenzie. I'm a psychiatrist at the Centre for Addiction and Mental Health and the University of Toronto. I'm here today to talk about the causes of psychosis. So when people think of the cause of an illness, they always think of something like pneumonia, where you get a bug and that bug causes the illness. But that's not how most illnesses are caused. In most illnesses, you don't find one single thing that causes the illness. It's more like heart disease. We all know that you might be at risk of heart disease because of your family. But we also